In today's episode, we discuss our children, our future. This is Caribbean Medical TV.
So one of the things that I like about pediatrics is that it's never just about the child, it's also about family, extracurricular activities, sports, school, all of those things we get involved in. I think one of the nice things is also that it's about empowering families or giving them the knowledge that they need, because that's often where anxiety comes from, when there are things that we don't know or don't understand. It's actually about forming a community of people who support each other. We're in this parenting journey together.
Today, we explore health and wellness in its earliest and most vital stage. Journey with us through the Caribbean to hear insights in the world of pediatrics. Let us head over to St. Lucia to join Dr. Christian, the head of the pediatric department.
So pediatrics is a specialty that cares for babies, so right after birth, up until around 16 years of age, depending on the setting that you're in. This is very important because we have, even though it's the pediatric department, we have the special care baby unit. Some persons may call it a nursery. We also have the pediatric ward, which basically caters for babies between the first 28 days of life up until you're 16 years old. We have an outpatient pediatric department where we see the well babies and the well children up until 19 years of age. And we also cater for the children who may be sick, who require some urgent attention, and who are being referred to our service in the emergency room.
Now, within the first 28 days of life of any human, beginning from that first breath of life, it's very vital, because I usually tell the interns, that the sound of a baby crying when that baby is born is one of the most beautiful songs that you can ever hear, especially if this was a pregnancy that was so hard and rough and tough, and then finally this little one is born. When you hear that cry, it's the most amazing thing, because the amount of changes that happens within that short space of time can mean life or death for any human being in that moment. So the first minute of life and then the first 5 minutes, it always plays a big part in how this child is going to end up, how this child is going to grow thereafter.
So the common admission period to here in the special care baby unit or the neonatal intensive care unit, it varies. So if you have a term baby who's big but may have some breathing challenges, it can vary from around 5 days to a week. Some babies may come for a day observation. Some may need phototherapy and might be here for either a few days. But now the premature babies, the very tiny ones, our warriors as we call them, they can be in here from up to a month, sometimes as much as 2 months or even more, depending on the challenges that they may face during the admission period. My advice to any parent in the Caribbean or the world watching this broadcast and who have a baby in the neonatal nursery, we know that it is rough, but we are here to support you.
So to our Caribbean mothers, I would say that prevention is the key. And how do we care for our children, bearing in mind prevention? 1, breastfeeding. Breast is the best, and then with the support of the vaccines, it helps to prevent the childhood illnesses. So let us try and focus on breastfeeding, because breast is best. And the good news is that once you breastfeed your baby, as they say, your baby's IQ would be much better and your child would be much healthier. And we also want to encourage vaccination because it helps to prevent childhood illnesses.
Thank you, Dr. Donald. There is much to be aware of during this critical stage of our children's development. Let's travel over to St. Vincent, the Grenadines, to hear from pediatric neurologist Dr. Duncan-Adams.
So children go through different stages of development. The neurological system goes through a rapid change for the first 3 years of life and continues to develop all into young adulthood. Before birth, there is a rapid development that takes place in the first 8 weeks of life of the neurological system. And it's a very critical moment in the development of an individual, because anything that happens during that time can result in a developmental delay or neurological problem later on in life. After a baby is born, we have our infant stage. Some babies do come out as premature babies. So you have your premature babies, and those are at higher risk if they are born before 37 weeks. And then you have your neonatal stage that goes on to the first 30 days. That is followed by the infant stage from 30 days of life all up to the entire year of life. And during that stage, it's quite interesting because the changes that take place are really profound.
Hi, I'm Ella and this is Hannah. We're two students visiting from the UK on our medical placement as part of our degree. And here in St Lucia, we've had an incredible time. We've been on the paediatric unit in particular and been following Dr. Christian and her team of amazing interns as well. And we've learned so much from clinical skills to the conditions that are seen much more commonly here compared to the UK.
Yeah, everyone's been really welcoming, the whole team from the first day, made us feel right at home here. We've learned so much about other diseases like sickle cell, which we don't really see much in the UK, but obviously they do have it in the UK, so it would be really useful to take our knowledge back there.
Dr. Christian has really took us under our wing. We've been involved in all the ward rounds. All of the doctors have helped us examine patients, do clinical skills, and then learning the differences between the UK system and the Caribbean has been, we'll definitely take so much back to the UK. Just different questions you ask, obviously we don't get dengue or chikungunya or Zika in the UK, so making sure that we are asking those questions, and if we miss anything, the doctors are there to be gently push us along.
The future of pediatrics is in good care across the Caribbean and globally. This continued education fosters an incredible resource in our next generation and beyond. Stay with us and we'll be right back with more.
Hello, I am Nigel Batiste, Group President and Chief Executive Officer of Republic Financial Holdings Limited. The Republic Group has always prioritized the holistic development of the communities and countries we serve. It's a mission driven by our flagship Power to Make a Difference corporate social responsibility program and the dedication of our staff, where we focus on 4 key pillars: the power to learn, the power to care, the power to help, and the power to succeed. For us, this is just the beginning of our sustainability journey, and we remain fully committed to unlocking financing to support the attainment of the United Nations Sustainable Development Goals, which ultimately would lead to a Caribbean region that is safe, healthy, and sustainable for many generations to come.
So I would encourage parents, know your child, be familiarized with what is considered normal development. Take your child to clinics regularly, especially your well child clinics, because sometimes it can be a bit difficult to pick up on these things when the child is actually sick. And a lot of times parents may actually take their child to the clinic only when they're sick. But there's an importance of the well child clinic. It's important to do it early because it's recommended that the earlier you start and you start intervention, the outcome would be 100% better.
So we have mandatory vaccines in Trinidad. So basically it's a 2, 4, 6 months, 1 year, 15 months, 18 months, 2 years. And at 2 months, 4 months, 6 months, our mandatory vaccines are what we call the DTP, which is diphtheria, tetanus. Everybody knows tetanus. Pertussis, which is whooping cough, which a lot of people be like, what's that? But that's actually making a comeback a lot through the world. And they're actually in North America now, they're encouraging family members and pregnant women to get the shot. If grannies come in to help take care, they say granny should probably get that as well, because you don't want to bring that on to a brand new baby, because that also leads to hospital admissions, ICU admissions. You have the H influenza B and hepatitis B. And then you have the pneumococcal vaccine, which is basically in terms of chest infections, common chest infections, and gives that prevention. So you get that at 2, 4, 6 months. Then you also have at 1 year our MMR vaccine, which I call it the Disney World vaccine, because measles is one part of the MMR vaccine. And again, because we've had such vaccine hesitancy, going into crowded areas where you don't know, all it takes is one child, and if your child isn't vaccinated, you're at risk. One of the most common emergencies that we see is actually febrile seizures, or as people like to call it, fever fits. And there are a couple of things that are pretty important to us, because it's one of the scariest things you could actually see, because it's common 6 months up to about 6 years. And it's super scary for a parent. You're seeing your child having a seizure. Oftentimes, you don't actually know what's happening when it first starts, because eyes may roll back, and once parents see that, they're like, what is happening? And knowing what to do is actually one of the most important things. So knowing, okay, recognizing one, it's a seizure, putting on the left side, in what we call the recovery position, supporting the head, not putting anything in the mouth, because and so people love to stick fingers, spoons, anything that they can. So no, you're just putting on the side and protecting, and making sure they have a safe space, so nothing there that could harm them.
So although fever is usually a sign of something not too worrisome, generally it's because of an acute viral illness. Parents should be mindful about fevers, particularly fevers last for a long time, such as more than 72 hours. This can indicate a more serious condition, such as a serious blood infection, brain infection, and in some cases, first sign of cancer. So if a child has persistent fevers, parents should be very vigilant and seek medical attention to address this. I would encourage all parents to have a thermometer at home and ideally check their temperature to ensure that it is a true fever. If there is a true fever, they should seek medical attention to address the cause.
Thank you, Dr. Dindial and Dr. Matthews, for sharing your insights. There is so much to the field of pediatrics. Development and awareness are just the beginning touchstones. How do we deal with a crisis at hand, including when it is environmental and can trigger something such as an asthmatic attack or other types of infection?
Prevention is the key. All right? How do you prevent yourself from getting a crisis? Knowing what triggers the crisis. It could be dust, it could be infection, it could be when your neighbor burns a bush, it could be when you cut the grass, it could be dust mites. All right? So you want to make sure that you educate the parents what are the things that can trigger off asthma in your child, so that they can know, adjust the environment to suit that. And how do we adjust the environment? We have to make sure we keep it clean. If you have a fan in your house, you have to wipe it with a wet cloth often. You try to avoid things like stuffed toys and too much carpets, because they attract a lot of dust. So in persons who have asthma, you would recommend that it's better to have a tiled floor than one that has, a carpet. So we encourage all of these things.
We'll be right back with more.
I am Navin Dukaran, CEO of Exim Bank, and we understand the power, impact, and transformative potential each citizen has. Our vision is to transform the domestic export environment and be the preferred trade finance service provider, creating value and making a difference in our national economy. Here at Exim Bank, we recognize that we operate within a complex rhythm that exists in our social structures and biodiversity. It is written in every community and generation. So let us work together to facilitate growth and expansion, creating sustainable employment while respecting our planet and our environment. Our nation's strength lies in the people and the generations to come from the work we do today. The journey is before us and the challenge is here. The need is now. We are but a reflection of the world we live in. So let's work together to make it a better, healthier, and more sustainable one.
So in children, typically I see a lot of fungal infections, bacterial infections. Parents will often come and say, oh, there's some white spots coming up all over baby's skin or their child's skin. What is it? Parents get very focused on skin and appearance. And so they'll often pick up on just the smallest thing. And it's good to catch these things early. But because of the humidity and the climate, what we do see a lot of here are fungal skin infections, and they're very easy to treat, very treatable. Yeah, something to bear in mind with fungal infections especially is that they're very contagious. So I always explain to parents or patients that it's important to wash your towels at high temperatures, not to share towels, wash your bed sheets once you've started your treatment, and just take care of your surroundings and your clothing and what you're wearing every day. Carpets, also mattresses, sofas will also reduce the amount of fungal spores you're being exposed to.
Our children face new and old challenges. Every day, medical professionals are working to combat these hurdles. It requires a community. It requires empathy, especially when it comes to pediatric cancer.
In pediatric oncology or cancer, it is very unique compared to adults with cancer. Unlike many causes or environmental triggers that cause certain types of adult cancers, it's very different from children. Majority of childhood cancers are genetically driven, and the child is born with a mutation that has predisposed them to get cancer from the time of birth. In the Caribbean, childhood cancers fall under three main categories: leukemia, lymphoma, solid tumors, and brain tumors, also known as neuro-oncology. The most common types of cancers we see in the Caribbean, and these statistics are very similar to global statistics, are acute lymphoblastic leukemia, also known as ALL, acute myeloid leukemia, Hodgkin's lymphoma, neuroblastoma, and medulloblastoma.
It's up to us to support our loved ones during challenging times, and this help comes in many forms. Even in the way we speak can make a lasting impact.
It's a Caribbean thing that we don't teach emotional intelligence generally. So children don't know how to understand their emotions, how to manage their emotions, how to even know their emotions and be aware of their emotions. So how do you then communicate how you feel and all of that? And a lot of psychologists and doctors have come to the conclusion that there is no separation between mental and physical health, because all our emotions have a biological basis, right? So if I hug my baby now, then my body releases oxytocin. If I'm happy, there are endorphins and different things going on. If I am stressed out, cortisol is being released. So there's a biological basis. The physical aspect affects the mental aspect. Little boy fall down, little girl fall down, both of them cry. We take up the little girl, we kiss her little bobo, we tell her it's okay, and we tell little boy, what you crying for? Get up, man up. We're telling him very early that he can't be vulnerable, that he can't express, he can't, all of those kind of things. So what he has learned all his life is that the main way of expressing his emotions is through anger.
It is all connected, the psychological and physical aspects of our daily living. That's why it is critical that we find balance.
WHO recommends is 60 minutes of physical activity for young children every day. Now, very few of our children actually get that. And what's happened, and I think even before COVID and lockdowns, but definitely got exacerbated during the period of online school, when a lot of kids actually moved indoors And we were spending much more time, parents as well, don't worry, I'm guilty, of time online and on our devices, and really just sedentary. And that's having lots and lots of untold medical effects. So for instance, we're getting kids with orthopedic issues, back pain, neck pain, for instance, text them because this is constantly moving. But our bodies weren't designed to move. You know, we used to do growing up, go out and kick a ball, play cricket, do those kinds of things. It's hugely important for kids' development to learn how to interact and problem solve and how to play with others.
The condition, obesity and overweight, let us start in utero. There are various factors which influence the condition, such as cultural factors. And you know, within our setting and other cultures too, the baby who is nice and plump with cheeks that you can pinch, that's looked on that they're healthy, but in fact, they are not the healthy ones. So we look at pregnancy, the weight gain in pregnancy impacts on obesity development later in life. Then we're looking at nutrition, playing a significant role. What's happened over the years is that our diet has been changed, our palates, children's palates have been changed. It's shown that when you are young, what you cultivate in a palatal taste is what influences what you select.
So I don't know if you would look at some of the soft drinks and the juice packs, right? If you were to take the amount of sugars in some of the juice packs, you will have 9 or 10 tablespoons of sugar in a juice pack. And in some of the soft drinks is tablespoons. Would you take 9 tablespoons of sugar and put it in the water and drink it? I don't think so. But yet we're giving this to our children and giving this to young people, and there are not many alternatives that we can use. And that's just the sugar. If we change that now, we have changed the diets. What are we making? The fried foods and so on. And if I want to say the fried aloo pie and the doubles and I don't want to say the fried chicken, and children are eating this and they're advertising and children are eating this, and so this is not helping the situation, you know.
So the child would say, okay, no, I had too much fried food this week already. Can I have something baked? Put it in the air fryer. People like air fryers now. It's a big thing. Air fry your food as opposed to the deep fry. You know, and I mean, if families could start making the transition subtly, you know, and then over time you realize, a year ago we were just eating out the fried things all the time. Now we're eating better. It's a process that I think the mothers, the fathers, the other guardians in the home, whether it's the grandparents or the aunties or the uncles, have to deliberately make a choice to transition away from the unhealthy choices for our kids. And I think that will go a long way, because we really can't afford for the next generation to be even more unhealthy than we are. We cannot afford that as a Caribbean people.
When we're preparing the lunch kits for our kids to go to school, I think we need to be more aware of the content of what we're sending with our children. So for example, it would be important if you're going to add a little snack, because we know at different ages children are selective with what they'd like to consume. Once we're going to add a snack that is filled with carbohydrates, we must make sure we have at least an equal proportion of fruit, something nutritious, and let us not forget, we need to send adequate amount of water. That is something that is lacking sometimes, where children are more prone to getting a larger quantity of the juices, the sodas, the sweetness. That is important, because these habits are going to be instilled in them, and as they get older, it's something that they will carry forward. And all of this, as simple as it sounds, will help to contribute the prevalence of diabetes and high blood pressure.
Food, nutrition, creating good environments for the child to be in, because thing that is ignored and especially or downplayed is the mental aspect and the psychological aspect for kids in the Caribbean. You have your child, you say, they're only on the screen, but what are you doing? Are you also just watching TV all day? You know, take them out, participate, especially with young kids. They wanna do things with mom and dad. that goes away. So enjoy that when it's there. Let's go to the beach. Let's walk down the beach. Let's see what's at the other end. Let's go hunt for shells, just get them moving and doing things. But we have to do that as well. And I think that's a big thing, is really make sure that we are participating and are not leaving things for everybody else to take care of.
Mothers in St. Vincent and the Grenadines and across the Caribbean, you are, especially if your baby is not yet born, you're carrying precious cargo. That's the first thing you need to know. You have precious cargo. From the moment your baby gives that first breath of life, that is something to rejoice about, because that first breath of life is not always an easy first breath. There are many things that occur, and the resilience of the baby contributes a lot to whether or not that baby makes it past that. After that first breath of life, you have your baby. You need to take care of your baby. The breastfeeding is important. Your checkups in your clinics, whether it be public or private, you need to do your follow-ups. Make sure if there is something of concern with your baby, do not be afraid to ask questions. One thing I always tell the new mothers especially, you notice something at home when you leave the hospital, you have a health center. Go to your health center. Ask the nurse. Do not miss your appointments, so that we can capture very, very timely what is going on with your child. Your child continues to grow healthy once you take care of your child. So please, take care of that precious cargo.
Your child's development is very important. We have a child for only a certain period of time, and even though we do not get a textbook on how to raise a child, our input is of importance. What we do or what we fail to do can have a long-term impact on the child. The first 3 years of life, the brain is like a sponge. It takes in way more than we're able to take in. And we need to harness that. We need to move away from just using technology and doing the quick fix of, putting in a pacifier for crying and using a device for your free time. We are seeing new emergence of pathologies related to this, and these are things that can be fixed from early. From my own personal experience with parents, there are some parents that when they came to see me, their child would have speech delay. They may not be interacting fully, and when we got to the bottom of it, it was because of lack of stimulation. And just after 2 months of being, for example, in a social setting that was conducive, of them putting in a little extra effort, we saw the change almost dramatically. So this is something that can be done. We should not get complacent as parents. We only have one shot, and our children's development is really important. So go for it, look out for your child, and do the best that you can do. That would be my advice, from my perspective to parents of the Caribbean.
It takes a community to foster family, and the Caribbean is fortunate to be home to one of the strongest communities in the world. We hope you enjoyed today's episode. See you next time on Caribbean Medical TV.